That's fun. Hey guys, so we're trying this again. Lisa Grant from Spring Mountains Wellness, Spring Mountains Fertility. Excuse me. I'm sorry. I'm trying to talk and do technical stuff here. Yeah, so I basically want to add her on, and we're going to do our second part of the baby making series, and we're going to talk about difficult fertility issues, such as endometriosis, PCOS, advanced maternal aging, and she's going to take you through those. So let me try this. Okay, let's try this again. Hey, Lisa. Yes, I'm live here now. I'm trying to figure out how to add you, and I can't add you for some reason. It's weird. Hey guys, we're having some technical issues. Our live feed. Adding. It seems like it's always different each time that I do this. But okay. So as Lisa's switching to her phone, we're gonna be starting soon about difficult fertility issues as part of our baby making series. It's a 5-part series. This is the second part. And last week we talked about all about your period, and we talked about BBT charting, about how that can regulate your hormones, about how acupuncture and Chinese medicine can help you change your PMS. Okay, we're going to try again. Oh, Lisa just left. I'm not sure where she's going. And okay. Hi, Lisa. Welcome.
Technology.
I
Okay.
know.
For whatever I don't know why my computer won't let me do this, so I'm going to go back to my phone again this week.
Okay, I'm not sure why either, but welcome and thank you for doing the first part.
Thanks everybody for their patience.
Yes. Um, so yeah, I was just talking a little bit about what we had talked about last week about all about your period and what we went over. We went
Mhm.
over BBT charting, over the hormones, how that can affect your period, and PMS, about how to track it. And you actually,
You froze on me.
can you hear me? Oh,
There we go. You're freezing. There we
am
go.
I freezing? Oh no, I think it's my connection. But can you hear me okay?
Oh, I can hear you just fine.
Okay, so I was just going over um, the different things that we talked about on the first part of our series. Hey, Adam. Um, and we talked about all about your period and how BBT charting can help you see what your hormones are going to look like, how that contributes to your ovulation, especially if you want to get pregnant. And
Mhm.
that's also something that you can think about if you want to get off birth control, because you can still have
Mhm.
sex, naturally. And that's something completely different than what we're going to be talking about today, um, which we're going to be talking about difficult fertility issues. And we're going to touch on PCOS, endometriosis, advanced maternal aging, and the stages within AMA. Um, and Lisa's going to touch on those for us. And if you have any questions, post below, give us a shout out. And we're actually going to go over some of the questions that some of our viewers have submitted to us too at the end. So, are you excited
Mhm.
about this, Lisa?
Oh, yes. Absolutely.
Okay. All right. Awesome. So, so in terms of difficult fertility issues, like what are the top 3 things that you have seen in your practice that are considered difficult
Um,
fertility issues?
I think it's right. I think it's the three that you mentioned. It's endometriosis, it's PCOS, and it's advanced maternal age. I'm seeing more PCOS now than I did when I first started working with fertility issues 6 or 7 years ago. I think there's been a dramatic rise in the number of patients that are seeking help with that.
Mm-hmm.
So I think that plus the advanced maternal age would probably be the two biggest issues that I see in my clinic.
Okay. And how has your success rate been with women who fall under these categories?
That's always a really tricky question because often, not always, but often there's another complicating factor. And one of the things I'm seeing a lot of is in PCOS patients, um, they'll have like hypothyroidism in addition to the PCOS.
Mm-hmm.
And so that they make things more complicated because with thyroid issues, that also impacts your fertility. So it really just depends on how many issues that we have stacking up. Um, and I always start treating patients who are coming in and want to try naturally, saying we're going to do everything that we can to get everything stable and improve your fertility as much as possible. But my promise to them is always, I'm not going to keep them on the hook forever and ever. If we get to the point where I say, you know what, we need to look at the possibility of starting some assisted reproductive technologies and bringing them in, then that's what we do. I think for PCOS, um, there it's if we can get some of the lifestyle contributions to PCOS under control, it improves the likelihood of getting pregnant dramatically. And we can go over what some of, the issues in PCOS is, and actually what PCOS is, because I think there's a lot of misinformation or misunderstanding out there about what exactly is going on in PCOS.
Yeah.
With advanced maternal age, yeah, it's basically what we're dealing with is the fact that the age of the eggs are the age of the woman. And, darn it, if some women don't have to wait because they don't find the life partner that they want to have a child with until later in their life. And that's important. And then they're also facing the issue, though, that they're a little older and their hormones aren't doing what they're supposed to do, and the health of the eggs have been impacted. So, lifestyle factors and changing things can always help improve fertility. Whether or not we can actually get a woman to the place where she's going to be able to conceive naturally just depends on a whole lot of things.
Sure. Yeah, it definitely depends on a whole lot of things. And those are some of the things that we talked about in the first talk, just re-regulating your period and
Right.
talking about,
Right.
what your symptoms are, like whether or not you,
Mm-hmm.
like, what are the symptoms that you're experiencing? Is it pain? Is it like, for example, like PMS, get irritated? Do you have pain before your period? Do you have swollen
Right.
breasts?
Right.
All of that stuff, like, and trying to track down when you're going to ovulate. Those are
Right.
some of the basic things. But then when you tack on
Right.
like hypothyroidism and whether or not you have that, like, that's a completely
Right.
different level.
That changes things. Right. Exactly. 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 So, what I'm wondering is can we start maybe with PCOS?
Sure.
It's the thing. I mean, how much do you see PCOS? Do you see a lot of PCOS in your clinic?
I have a handful of people who come in with PCOS, and
Yeah.
I think that would be, I do agree. PCOS is on the rise, just because of,
Yeah.
I, I talk about clean beauty, and that's something that, what is clean beauty? Like, it's putting stuff on your face and what is actually in the substances that you're putting in your face, as well as like what you eat. And
Right.
a lot
Mm-hmm.
of those things
Mm-hmm.
affect your hormones, whether or not like
Yep.
what you're putting in your body.
Yep.
And so I truly
Right.
believe that that's something that um, there's definitely more of, um, and how it contributes to everyday life, how it contributes to
Mm-hmm.
energy, whether or not you're like really
Yeah.
tired all the time, whether, weight management,
Yep.
even, whether or not you're having your period or having a really heavy period, and what that actually
Right.
means. So I guess maybe we
Mm-hmm.
should cut to the basics of PCOS. Like, I described some of the symptoms,
I think, yeah, let's, mhm.
but
Yeah.
can
I think
you break down the
sorry,
basics
there's
of
overlap there.
PCOS?
Yes. So here's a lot of women get diagnosed with PCOS when they're trying to get pregnant. But one of the things that's really important to understand about PCOS is that PCOS is not a reproductive problem. PCOS is an endocrine problem that shows up in the reproductive system, and women may not know that they have it until they're trying to get pregnant. And the name polycystic ovarian syndrome, PCOS, actually is the beginning of the problem of understanding what's going on, so that, and then that makes women think that, oh, it's only a reproductive issue, but it's a much larger problem.
Yeah.
Um, it's called polycystic ovarian syndrome because way back when it was believed that the ovary was creating lots of little cysts. So if you looked at the ovary, instead of having just a few little, imagine the ovary as a muffin, okay? And instead of having a few developing follicles, and the muffin, if it was a muffin, it would look like, like a raisin muffin or a blueberry muffin. instead of having just a few raisins, the whole top of it, all of it would just be completely covered in raisins. And they were calling those things that were showing up in the ovaries cysts. But what we now know is that those aren't actually just cysts. What they are follicles that are trying to develop because the hormonal balance of the woman is off. So it really shouldn't be called polycystic ovarian syndrome. It should be called polyfollicular ovarian syndrome. Because when you are thinking about it medically and from Chinese medicine in terms of these are follicles that aren't growing, that changes how you treat the issue. And what we now know about PCOS is that it's actually a dysfunction in how the body is dealing with high blood sugar levels and insulin. So in PCOS, what happens is, you know, the woman will eat something that will spike her blood sugar level. And normally, a normally responding body would keep the blood sugar level within a certain range and would secrete insulin to do so. But what happens in a woman that has PCOS is that she has a highly exaggerated response to the high levels of blood sugar and the high levels of insulin, and that increased response to insulin actually creates a whole lot more testosterone than she should have.
Mm-hmm.
And that's where a woman with PCOS runs into trouble, because it's the high levels of testosterone that create all of the reproductive issues. Okay, and I know that's kind of technical, but really what it comes down to is this. Our women have testosterone. We're supposed to have testosterone. Actually, we get our sex drive from testosterone, okay? But too much of anything is never a good thing, as I pointed out last week, including chocolate, which is really sad. But if you have too much testosterone as a woman, what it'll do is testosterone acts like the pilot light underneath the follicles. And if you have the right amount of testosterone, then what happens is you get an appropriate follicular development, and then you're good to go. Okay, so you have a few follicles that are developing, and one of them, once you get to ovulation, will get the golden ticket and be the one that ovulates. But when you have too much testosterone, instead of a few pilot lights, you have like a bonfire going. You've got pilot lights everywhere. And the problem is that you've got so much testosterone that you've got all these follicles that try and develop, but they don't actually, your body can't secrete and match all of those follicles with the appropriate levels of estrogen. So what happens is too much testosterone, the estrogen gets thrown off balance. And so instead of having one follicle that gets the golden ticket and that responds to the body's hormonal, secretion of, okay, somebody ovulate, none of them actually develop to the point where they ovulate. So often women with PCOS will have these really crazy long cycles where instead of 28 to 30 days, it'll be, 35 days or 40 days or 50 days or 60 days. And it's almost like you skipped a whole period in there and you just went through one cycle and then you have this humongous period at the end of it. And the problem is that the testosterone is getting in the way of the normal functioning of the hormones that actually help your follicles develop normally. And that's what whacks out the woman's cycle. It whacks out her period. And the increased testosterone creates all those things that are often listed as symptoms of PCOS. And that's, a little bit of extra hair in places like the upper lip or in the abdominal area, the inability to lose weight, or the having just carrying around a little bit of excess weight. Mm-hmm. That's all the testosterone. Some women with polycystic ovarian syndrome will actually start losing hair because too much testosterone will actually cause hair follicles to shed. So you'll have not hair where you want it and hair where you don't want it. And then there's the issue of the crazy cycles. And the reason this becomes a problem for fertility is the woman who's got PCOS isn't creating healthy follicles that have the appropriate hormonal balance that create that normal cycle that we talked about last week. What she's got is too many follicles, but none of them can mature correctly. And so she just never gets a consistent cycle, or her ovulation is too late, and so the egg basically loses its ability to fertilize, and all those sorts of things. That's classic PCOS.
Mm-hmm.
Everybody with me so far? All right. There's another kind of PCOS, which I call it skinny PCOS, because it's women who have just a little bit too much testosterone. So they don't have all those classic symptoms, and they may have a cycle that's just a little bit longer than normal, like, 30 to 31 or 32 days, okay? But if you look at their basal body hormone chart, the basal body temperature chart, you'll notice that the ovulation is happening just a little bit later, and often her temperatures will just be a little bit lower than I want them to be. And that's the sign that the follicle isn't as healthy as we wanted it to be.
Mm-hmm.
And so it can't secrete the progesterone normally or enough. So it just takes, it's like it takes the spin off of the fertility just enough that she just can't quite get pregnant. And often women who have what I call skinny PCOS, what happens is, if we can get their lifestyle issues under control, pretty much if we can get their insulin under control, that's all they need in order to be able to get them into balance and get their cycle back on track. And a woman with skinny PCOS, the way I can usually tell that she's got it is, like, the single biggest flashing neon sign is if she gets shaky when she doesn't eat. It's really hard to clinically diagnose hypoglycemia, okay? But that's basically what she has, is she'll notice that if she doesn't eat regularly, or if she binges on a bunch of stuff that has sugar, she'll get shaky, she'll get hangry, she'll just feel off, okay? And that's because that's her body telling her, oh my gosh, we have all this sugar on board. What we need to do is we need to release all sorts of insulin to help deal with this, okay?
Mm-hmm.
So what winds up happening is, instead of having sort of, nice steady state insulin, what she's got is peaks and drops. And that peak and drops is just enough to interfere with her fertility hormones. So if we can get her on a diet, and I shouldn't say a diet, if we can get her on a nutritional plan, because this is a lifetime deal, and we can stabilize her insulin, my highest rate of success is with these women that have skinny PCOS, where if we can get it so that they stop the spikes and drops by eating a more, a slow metabolic diet, then they can often get pregnant naturally without any kind of artificial, assisted reproductive technology. Okay. But here's the thing about PCOS, and I want to emphasize this to any woman who has PCOS, whether you're trying to get pregnant or not, and that is this: PCOS is not a reproductive issue. This is a endocrine issue. And what that means is that women with uncontrolled PCOS wind up at higher risk for all sorts of other things like diabetes and strokes and heart attacks because of the uncontrolled blood sugar that's going up and down, okay? And the beautiful thing is that if you can create a nutritional plan where you're eating more healthily and you're stabilizing your insulin levels, you dramatically decrease your risk of all those other nasty, diseases, because it's the insulin that creates the problem. And once you get the insulin under control, the risk factors for all those other things drops to almost normal levels. So that's why it's really important to understand that PCOS is not a reproductive problem exclusively. It is an endocrine problem, and you fix the reproductive problem by dealing with the endocrine side of it. So that's sort of how PCOS impacts the fertility, and that's why with PCOS, working with either an acupuncturist or a nutritionist that understands that nutrition really is the foundation. If you don't get the nutrition under control and get the nutrition stable, you can't, and you're not going to be able to, you're not going to be healthy. And a lot of my patients, when we, and it's kind of strict, actually, okay, I take that back. It's a really strict diet in the beginning, because it's so different than what my patients normally come in eating, okay? Basically, what you have to do is sugar is out, and you need to always be eating whole grains. It's like, because sugar is the problem.
So wait.
So, and by sugar, I don't mean just
Sorry, maybe you're okay.
Go ahead.
Just keep on going. Like you're talking about sugar. So I was, yeah, just sugar
Yeah,
and the
by
different.
sugar, I don't just kinds of sugar. And by sugar, a bag and you spoon into your tea. And I mean anything that's white is sugar. So white rice, white flour, white pasta, white bread, anything that is basically something that used to be a whole grain where the bran has been stripped, that's sugar. So white pasta is basically sugar in the shape of pasta. White bread is basically sugar in the shape of bread. White rice is basically sugar in the shape of a little rice granule, because what's happened is they've stripped all the nutrients that turn the grain into a much slower metabolic burn food source into basically sugar, sugar that's in a shape. And so when you eat it, white stuff spikes your blood sugar levels dramatically, and then they drop. And that's all that it takes, no matter what kind of PCOS you have, either classic or skinny PCOS, to create problems. So the first step that I counsel all of my PCOS patients to do, and actually, to be completely honest, I counsel all my patients who are working with fertility to do this, because white stuff it has no nutritional value. It's basically sugar. Okay. And so when you strip the bran off, all you're getting is basically calories, but no nutrition. And it's a problem for fertility because we need what's in the brown part. Okay. So sugar is defined in my practice and in my house as anything that's classified as sugar and anything that's white. And my younger son has tried to argue that honey should not count and neither should turbinado sugar because they're brown. But sugar is still sugar. I was like, chemically, and as somebody who's doing a STEM major, you understand this. Chemically, it's still sugar.
Yes.
So no, you don't get a pass for sugar that's brown.
No, you don't. And that's another thing.
No, you don't.
No, and that's another thing right now too. There's a lot of research talking about leaky gut issues and the
Mm-hmm.
digestive
Yeah.
tract, and um, there's a lot of issues with just metabolism in a nutshell. And that's something
Mm-hmm.
that you and I both see in our practices, and that can affect
Mm-hmm.
um, how you absorb nutrients, how the
Yep.
hormones are secreted by your body. Um, and
Mm-hmm.
that's something that, like, if you're working with somebody such as Lisa or myself, or a nutritionist, or your local acupuncturist in your area, that's something that with PCOS that you can look into, just because if your digestive lining is wrecked, um,
Mm-hmm.
even changing your diet in some way isn't always going to um, help you. Does that make sense? Like,
Well, it does. Wait a minute. So just changing your diet isn't going to
just
help? Changing, I'm
like
not
if
sure I
you
understood what
can
you meant.
change your diet, but I guess, like, when we talk about changing diet or going on a nutritional plan, each one of those nutritional plans, and this is what I
Mm-hmm.
want to emphasize, is that the nutritional plans are customized per patient.
Yep. Right. Exactly. Exactly. Um, yeah, and the nutrition, nutrition is the foundation of good health. And the thing is that if we can get your nutrition in a good place, any complicated fertility issue, or quite frankly, any sort of internal metabolic issue, then what that means is that you will be giving yourself and your acupuncturist, your healthcare practitioners, a healthier body to work with. Okay. We have this crazy alchemical process where everything that we put into our mouths actually turns into blood and bone and hormones and cells and brains and, follicles and sperm. And if what you're giving your body isn't decent quality, it's kind of like building a house. If you've got every third brick missing, well then, okay, you still have a house. It's just probably not going to be as functional as you want it to be. And if things aren't going well, like if you are in work particularly well. The issue is that when you don't have good nutrition, you wind up not being able to give your body the molecules that it needs in order to build a good foundation. So that's why, part of working with an acupuncturist who specializes in fertility, we're going to talk about nutrition, because the more we have your good nutrition lined up with what we're doing, the more likely it is that we're going to succeed. And we're actually going to talk about this in the 5th talk, which is, it was eating healthy, wearing healthy. And we're going to talk a little bit more about some of the nutritional stuff that's just foundational. But, everybody knows that they shouldn't eat sugar, but not everybody understands the link between like sugar and that kind of sort of American standard diet and how it can impact your fertility. Bottom line is sugar is inflammatory. Okay, and sugar whacks out insulin, and insulin is the gateway hormone to your reproductive hormones. It's just that simple. So if you can get rid of sugar in your diet, and again, by sugar I mean anything that's white, or has the chemical composition of sugar, if you want to argue with my son, then you're going to be in a better position to have a healthier response and a better response to the acupuncture that we are doing in order to help your fertility. So, and that actually is a pretty good segue into endometriosis. Can we start on that a little bit too, just in case we've got anybody who's watching?
Perfect place.
Okay. Because endometriosis, so what do endometriosis and PCOS have in common? The thing that PCOS and endometriosis both have in common is that there are defects in the way the body is responding to outside stimulus, okay? In PCOS, the insulin levels are spiking and dropping, and that drives an imbalance in your reproductive hormones. In endometriosis, there are 2 mechanisms for endometriosis. And endometriosis is still a really tricky, thing for us to deal with, okay? Yeah. But you have 2 things. First of all, when a woman has her period, okay, the uterine lining cells leave the body. But there's always a few cells of the endometrial lining that escape up into the abdominal cavity. And this is whether you have endometriosis or not. It's kind of like squeezing the tube of the toothpaste and it comes out the back in addition to the front, right? Normally what would happen in a healthy, in a healthy reproductive system is that the immune system would see those endometrial cells that are kind of floating around in the endometrial cavity and realize, oh, hey, those aren't supposed to be here, and they would clean them up, okay? But what happens in a woman who has endometriosis is there's some sort of cellular and humoral immunity defect, okay, that basically allows the endometrial cells to escape and to start sticking to things that they shouldn't, okay? So the endometrial cells stick to the various, organs and tissues inside the abdominal cavity, whether it's the outside of an ovary, whether it's the outside of the uterus. They often stick on the lining on the outside of the various intestines. And then the second problem, so that sticking thing, that's not good, okay? Then the next thing that happens is that usually inside the cell itself, there would be an automatic die switch, okay? Cells die. And usually once they reach the end of their life, the little switch flips on, the telomere says, hey, you're done, okay? You're finished, your job's done. And it dies. But endometrial cells, in endometriosis, the cell doesn't have that kill switch. It doesn't die. And then the other thing that happens is those immune complexes that are usually floating around in our system that basically recognize pathogens and recognize, stuff that's where it's not supposed to be. Those immune complexes usually latch onto cells that shouldn't be there and cart them off and dispose of them. But the endometrial cells in endometriosis are secreting hormones that basically say, don't kill me. I am where I am supposed to be. I am good here. We're all good. It's fine. Everything's fine. How are you? And what happens is that the immune system doesn't clean up the cells. Mm-hmm. So then they start to multiply and grow and grow and grow. All right. And then what you wind up with is endometrial cells where they shouldn't be, growing the way that they're not supposed to be, not dying the way that they should be, and the immune system basically giving them a pass because of the chemokines, the hormones and factors that the cells are secreting. And what happens is they grow and they grow and they grow and they start sticking. And that's why a lot of women who have endometriosis have such terrible pain, and the pain is not limited just to their period. Their pain is actually throughout their cycle because the cells are growing and doing things in places that they shouldn't, and it irritates the nerve endings in various places. And to go back to the link with PCOS, sugar and anything that's inflammatory is actually going to accelerate this process and assist this process, because when you have inflammation, it basically interferes with the signaling of the immune system, and it further prevents the signals from being received by the body and the cells the way it should be, and interferes with the body's ability to clean things up. So as much as I hate to say it, because we adore sugar, everybody loves sugar, sugar is really, 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 really bad. And this is why when you're working with fertility issues, you have to get rid of the sugar. Yeah, and all the white stuff, all the sugar, because it's inflammatory, and it further impedes the body's ability to talk to itself and bring hormones and its immune systems back into normal full functioning. With endometriosis, one of the things that we have to work on is trying to get these inflammatory chemicals that these cells are secreting under control. Now, here's the thing about endometriosis. The other piece is that endometrial cells are hyper responsive to estrogen. And there are things that people eat every day that normally would not be a problem, but in a woman who has endometriosis, they're a problem. And the big one is soy. Okay? So women who have endometriosis need to avoid things that have soy in them, because the soy is actually increases the amount of secretion of estrogen. And if things that you eat are estrogenic, it actually further imbalances the cells and the hormones, and it increases the amount of endometriosis that's growing. So for all of my patients that have endometriosis, they have to avoid soy products. So no tofu, no edamame. It even goes so far as soy sauce, because all of those things will actually hyper accelerate the growth of endometrial cells. Okay. And that is reducing sugar and getting rid of estrogenic foods are two really important steps in dealing with endometriosis, because as acupuncturists, we can only work with what the body, what our patients bring to us in terms of their bodies, their hormonal balance, and their energetic balance. And it's progress goes much slower if you're doing things outside of our office that are actually, supporting the dysfunctional processes and creating the dysfunctional processes, as opposed to if, we teach you these things, okay, yeah, I know you love your sushi, but, you got a twofer there. You got the white rice and you got the soy sauce if you've got endometriosis. So we love sushi, but stick with sashimi, because sashimi is fabulous. Sashimi is great. It's fish, right? You can't go wrong with fish. So, but if you're eating things that you don't even know are causing problems, then, you're going to come in and we're going to be constantly fighting a battle where we're trying to fill in the holes that the lifestyles are creating, as opposed to making forward progress in terms of having our patients making lifestyle choices that actually help improve their health and also their fertility. So,
Exactly. Yes.
right? So, do you have any sorts of thoughts about other foods that might actually contribute to, that are estrogenic, that might contribute to endometriosis, or that might contribute to the PCOS? And what do you notice about women with endometriosis and women with PCOS in terms of maybe how it shows up in their skin? Like, what kinds of complaints and symptoms do your patients have around those two diagnoses?
So, so with endometriosis, I kind of see more of dry skin,
Okay.
can be, I'm not sure if this is the case with most women who have endometriosis, but I see more of a dry skin issue. But
Okay.
to me, it seems like it goes hand in hand with the stagnation. If we talk about
Yep.
energetics of
Right.
internal
Right.
medicine, like how things move in the body, and if things aren't moving in the body, there isn't circulation to the skin, so it
Right.
gets stuck.
Right.
And
Right.
um, if you aren't nourishing your body and getting the circulation, you're going to have drier skin. It's going to be a little bit thinner. That's what I've noticed with
Okay.
endometriosis. Um, with PCOS, I see more of a like obvious difference. Um, with the classic PCOS, I see more acne,
Mm-hmm.
more of
Mm-hmm.
the damp, um, pus-filled acne or cystic acne, like definitely
Yep.
around these areas or around the cheeks, and
Yep.
and then I see also what we mentioned about the testosterone causing more hair growth, and so
Right.
like
Like here and then here.
yeah, a little bit here and like around the jawline. Um, So I'll see those with classic PCOS, but then I also see in what you call skinny PCOS, like drier skin.
Yeah.
The pallor or the complexion of the skin is kind of um, lusterless. It looks
Okay.
more dry and
Okay.
just
It doesn't have that vitality. It doesn't have that sort of glowy, peachy look. The
right.
healthy skin look. Yeah.
Yeah,
Yeah.
kind of
Yeah.
um,
Yeah.
more patchy in a way. Not
When you
in
say patchy,
uh, it just looks drier in general, and it
yeah.
definitely doesn't have that glowing, dewy complexion that you
Right.
might see.
Right.
Um, and
Yeah. One of the things that I've noticed from my patients who tend to be like the skinny PCOS, which is basically the hypoglycemic issue, is
Mhm.
that if they eat sugar, they'll break out. If they don't eat sugar, they won't break out. And sometimes with the classic PCOS, they always are dealing with acne.
Mhm.
But with the hypoglycemic PCOS, I notice that it's almost a straight line correlation between the sugar and breaking out. And they won't go cystic, but they'll just notice, yeah, they'll get some spots.
Yeah, that makes sense too.
Yeah.
Yeah, 'cause,
Yeah.
like if your skin is drier, it's gonna trap stuff in it. It's also
Right.
like blood isn't coming to your skin, and
Right.
it's all circulation related. Like if
Right.
you're not getting blood flow to your skin, you're either going to develop cystic acne or you're going to develop blackheads, which can become something else. Um,
Right.
Skinny PCOS, like the skin's a lot drier, so you're going to develop more blackheads.
Right.
and
Right.
things.
And not that those are necessarily diagnostic, but taken as a whole, when we look at, when we do an intake for women who are dealing with fertility, you know, that's why we're going to ask, what's going on with your skin? What do you notice in your cycle? You know, when do you break out? Is there any correlation? Because it can just be one more piece that'll help us diagnose it. One of the things that I'm also noticing recently about my PCOS patients is that they don't always know they have PCOS. And there have been many patients in the past year or so where when I start asking them questions about, you know, their skin and their cycle and what's going on, you know, and if they get that shaky, you know, if they don't eat, shaky hypoglycemic thing, then putting all the pieces together, you know, we cannot technically diagnose PCOS because that's a Western medicine diagnosis. But I will often suggest to my patients, hey, you know what? This looks a lot like PCOS, and you might want to go and ask your doctor to do some testing to confirm the diagnosis, just because it is helpful if to know if that is something that shows up in Western medicine blood tests, because then what that can do is inform our treatment and our diagnosis and our treatment, and make it so that we can give you an even more personalized treatment and nutrition plan that will help you deal with those issues. So, you know, there are a lot of things that Western medicine can help, that we may ask you to go talk to your doctor about, because often working with the two medicines, you know, the two medicine systems hand in hand, we can actually make treatment of your issues a lot more comprehensive and actually a lot more effective.
Yeah, definitely. And you were asking me about like what some foods um, to cut out, like in terms of like what could be estrogenic. And
Mm-hmm.
I I definitely agree with you on the soy and cutting out the
Okay.
white stuff. Um, I definitely like the Whole30 diet, diet nutritional
Okay.
plan, just because it's just straight plants, straight veggies, and meat. And if you do the
It's
grass-fed
basically,
stuff, what?
okay. It's basically paleo, isn't it?
Yeah, you can call it paleo. I think if you just stick with like organic veggies, fruits, and your grass-fed meats, like that's really, really good. Because like what is considered estrogenic? It could be from phytoestrogens. It could be from like processed
Right.
veggies that you don't even know like if it's organic or not. Because some of the
Right.
pesticides that are used can be estrogenic. And if you
Right.
go with grass-fed meat, um, you know that you're getting possibly the best that you can get instead of
Right.
um, meat that's been fed like a lot of corn. I mean, this is completely a different issue, like the GMO stuff, but you don't know what's being fed to the animals that you're eating. So
Right.
if you can
Right.
keep it as clean as you can, um,
Yeah.
that that's the best way to contribute to balancing your hormones that way. Just because, like, estrogens, hormones are stored in fat, they're stored in organs, they're stored in meat. So, I mean, that's another reason why, like, you want to, go with grass-fed meat
Right.
and organic
And one of the
veggies.
things that Right. One of the things I want to mention is we will talk about this more in our fifth baby making talk, when we're talking about, you know, what is it? Eating well, eating clean. Now I can't even remember the topic title, but eating clean and help me out here. Um,
Eating healthy, wearing healthy.
Thank you. Eating healthy, wearing healthy. I've got clean stuck in my head. Eating healthy, wearing healthy, because we're going to talk about the issue of endocrine disruptors and things like that, which all are food is a vector for things that can actually send signals to your body that are a problem. And that can obviously impact fertility. It's also something that I will be discussing in depth in my course when, that I'd like to start in mid-October, where we're going to be basically, it's my 90-day reset, my 90-day fertility reset, but it'll be the online component. And what we'll be covering is all of these sorts of issues with the specifics of how to, given your specific diagnosis, if you have one, what you can do in your daily life to help improve your fertility and minimize the impact of day-to-day choices on your fertility, so that even if you cannot work with an acupuncturist that specializes in fertility, you will know what you need to do in terms of your lifestyle to help support things. And then I'm just looking at the clock. We've only got 10 minutes to talk about advanced maternal age. So can we maybe talk about that a little bit?
Yeah, of course.
Because I know it's a big topic. So advanced maternal age is considered, it's any woman who's over 35. And I know that doesn't sound very advanced, but the concern that we have is this. A woman's eggs are the same age as she is. Women are born with all the eggs that they're ever going to produce, as opposed to men who develop sperm once they hit puberty. When women are in utero, when they're the ones that are the babies, the ovaries develop and reach a certain stage and then basically stop. Okay. And then when a woman reaches puberty, what happens is the ovaries are reactivated by the brain, and each month a group of follicles is kind of brought out of cold storage and actually start the developmental pathway. And the developmental pathway takes 90 days. So, and at the end of those 90 days, one of those follicles gets the golden ticket and gets to ovulate and try and become, fertilized. And the reason that we're concerned about advanced maternal age is whatever has happened to you in your lifetime and whatever you've been exposed to and whatever is going on, your eggs are also the recipients of those things. And there's a very significant decrease in the fertility of an egg when it reaches the age of 35. So that there are steps. It's 35, and then from 35 to 37, 37 to 39, and there's a pretty significant drop off after 40. And then of course, once a woman gets to about 45 or 47, then it's very difficult to have her conceive, because most eggs have just genetic issues that are going to create problems. It's not to say that it's impossible. It's not. We all know stories of women who get, pregnant at 45 and everything is fine. But statistically, what you're dealing with is a much higher likelihood that the woman is going to miscarry, because the egg, and then therefore the embryo, just doesn't have the internal power, or just has so many little genetic coding issues that it just can't sustain a healthy pregnancy. So one of the things that acupuncture does, so given that fact, it's like, how can we even say that fertility acupuncture can help, improve the egg? And the answer is this. Even though, remember when I said that, all of the issues that all of the things that the woman has been subjected to or has experienced, the egg has also experienced to some, degree or another. But you can rewind that to a certain extent by making sure that the nutritional, the nutrition she's giving her body and the hormones are actually running well. One of the reasons that women who have who don't go an acupuncturist for fertility don't have as high success rates as women who do see acupuncturists for fertility is that by rebalancing the hormones and getting the hormonal dance to be appropriate, we can actually rehabilitate the egg, and the egg is going to respond to the better hormones. The egg is also going to respond if the nutrition is there. Remember, go back to the house metaphor. If you're building a house with every third brick missing, it's technically a house. It's probably not going to do a great job. But if you can go back and you can fill in some of those holes, then the house actually becomes more functional. And it's the same sort of way with the hormones and the nutrition. It's basically putting back some of those those bricks and those nutrients and those hormones that the eggs need in order to be able to function effectively. Okay. So one of the things that we know is that acupuncture, hand in hand with nutrition, hand in hand with herbs, because every woman who has a difficult, has a diagnosis of some sort of fertility issue, herbs, the Chinese herbs really make a difference.
Mm-hmm.
We can actually rehabilitate the egg to a certain extent so that it's going to be more receptive to the hormonal signals that the brain and the ovaries are sending out, and it's going to be more likely to be able to respond appropriately, and being able to respond appropriately paired with just a richer, stronger, hardier, healthier egg is going to make it so that conception is actually going to be more likely, and that not just conception, but a successful implantation and embryo development is going to be more likely. So that's how this all works, is because when acupuncture rebalances the hormones, when the lifestyle counseling that we do to help create a personalized nutrition plan that will actually address the underlying imbalances of our patients. And then, at least in my practice, because I pretty much put all of my fertility patients on herbs, and the herbs are like getting a mini acupuncture treatment when they take them. And the herbs continue the hormonal balancing work that we're doing and make the body more able to absorb the nutrients and be in a stable place. That's how we can actually help treat and improve fertility, even with a diagnosis, of PCOS or endometriosis or advanced maternal age.
Mm-hmm. Yeah, that's great, Lisa. And just to recap a little bit about the herbs, taking herbs and acupuncture, like when a patient comes in to see either one of us, like we go over the symptoms and
Mm-hmm.
what's going on with each one of the patients, and each one of our
Mm-hmm.
um, treatments is customized per patient. So
Yep.
this
Mm-hmm.
is not like going to see a Chinese medical practitioner isn't going to see, okay, we're going to give you the same thing that somebody else is getting.
Right.
So these treatments, like acupuncture included, herbs included, nutrition plan included, is all customized per your life. And that's something that I want to emphasize,
Mm-hmm.
just because like
Right.
we all have different lives, and um, we, one woman versus another woman isn't going to have the same outcome like with one plan. So,
Right.
um, so if you think that, okay, Chinese herbs, which Chinese herbs do I need to take to improve this? Like it's highly advised to see one of us or your local acupuncturist or a trained herbalist in your area. Um,
Right.
and that's how we train, just because like herbs have different functions and what they do
Right.
to improve the hormonal balance in your body, as
Right.
well as like how we see the body. Like as practitioners, we ask you so many different questions because it helps paint a picture for us to say, oh, okay, do we need to warm the body? Do we need to move the body? Do we need to build things? Do we need to,
Right.
those are some of the energetics with Chinese medicine. Um,
Right. Literally every body is different, and one woman's PCOS isn't going to look like another woman's PCOS, and it may very well be that it's one woman, and I actually get down into the nitty-gritty of, I'm like, what do you generally eat every day? Because most of us pretty much eat the same thing.
yeah.
And finding the different places where maybe sugar is hiding that she doesn't recognize, or I have a lot of people who say, well, it's whole grain bread, or it's it says whole wheat bread, and it's like, well, but if you look at the ingredients, whole wheat is only like 25% of it, and the rest of it is white wheat. So there's a lot of education that goes on in terms of helping patients understand what they need to be looking for when they're reading labels and buying food and making food. And the ability that we have is that because we only see 1 or 2 patients an hour, is that we can really personalize these plans so that our patients are more likely to actually stick to them and be able to implement them. Because, you know, we've all tried diets, and it's this generic cookie cutter thing, and it doesn't work because it doesn't match with your lifestyle, it doesn't fit into how you function. So what we do is we can actually, you know, it's almost like getting into your pantry with you and saying, yeah, these things you can keep, these things you can't keep. For example, a lot of my patients can't eat breakfast. They don't feel good when they eat breakfast. So what we do is we figure out a way around that so they're still getting nutrients even though they can't eat it, right? So, and we'll talk about
Mhm.
that again a little bit more in the fifth talk. But the magic and the beauty of Chinese medicine is you're getting a personalized treatment program or treatment and a personalized health program that helps you actually achieve your goal in a way that it works more for you. It's never a cookie cutter. It's never a cookie
No, it's
cutter.
never cookie cutter. Um,
Yeah.
so we're gonna wrap up soon. Can we go over some of the questions that some of our listeners have asked us?
Sure, just
Okay.
really quickly,
All right.
because I
So
got to get into the clinic
okay,
soon.
so just going over the baby T charting stuff that we talked about um, last week. So I'm tracking my temps, and the peak day doesn't align with my cervical fluid. Is that normal? So this is a woman who's trying to conceive, and
And she's using the ovulation predictor kits.
I'm not sure if she's using that, but um,
Usually when they talk about peak days, they're talking about that's the ovulation predictor kit. And sometimes what'll happen is the OPK is a tool, but it is not perfect. And ovulation predictor kits, the problem is that it's just measuring how much luteinizing hormone you have. And oh, I didn't mention this. If you have PCOS, ovulation predictor kits are less than worthless because they don't work when you have PCOS because of the hormone imbalance. So if they're not matching, either she's got some sort of underlying condition that's keeping the OPK from working, or the other possibility is that sometimes women think that their cervical mucus is egg white, but it's not actually. It's what they're describing as egg white isn't. So if because usually, I mean, if everything is all things being equal, usually you would see a match between those two things. So I'm
mhm.
not sure exactly what's going on, but it could be either of those things, and that's where, you know, again, I'm going to pitch for us having an acupuncturist knows sort of understands what the BBT and what the OPK is doing. We can help diagnose because there are several different reasons I can think of that why that might be the case.
Okay, great. Thank you. So Lisa has to go, and we have three more parts of our baby making series. Next week, we're going to talk a
Yep.
little bit. We're going to talk about IVF, and I think we're going to talk
Yep.
a little bit about miscarriage as well, just because
Okay.
that's something that leads to IVF or possibilities
Right. Right.
of, and yeah, we're going to take it from there, and then we also have Lisa coming on with her pilot program in October. So if you're interested in how to read your BBT chart, how to be more concise with it, hit her up. And
Yep.
if you
Send me
love
a
this,
message.
if you guys like this material and know people who can benefit from it, share it, like it. Um, Let us know how you like it. And we'll talk to you next week at 11 a.m. Tuesday again.
Thanks,
Thank you, Lisa.
everybody. Bye. Thanks,
Take care.
Eva. Bye.